Do you need to sleep in total darkness? We think so. According to the journal, light at night in older age is associated with obesity, diabetes, and hypertension. The study found that light at night is associated with negative health outcomes and metabolic risk factors. The study examined 552 community-dwelling adults aged 63-84 for cardiovascular disease risk factors with 7 days of activity and light measurements. They were instructed to wear special bracelets to measure sleep time and light sources in the environment. In this study, 46% of the older adults had 5 hours of total darkness, no nightlight, in each 24-hour period, while 54% of the participants were exposed to some light during the 5-hour night. The study found that the group with no period of complete darkness was more likely to have obesity, 41% versus 27%, diabetes, 18% versus 10%, and high blood pressure, 73% versus 59%, than the group with periods of complete darkness. However, there were no significant differences in the risk of obesity, diabetes, and hypertension between the low and high nightlight groups. Reasons for the negative health effects of light during sleep. 1. Light stimulates the activity of the autonomic nerves, making it difficult for the body to fully relax. When the eyes are stimulated by light, photoreceptors in the retina send light signals to the visual cortex in the brain. The activity of the visual cortex affects the autonomic nervous system, such as increased heart rate and blood pressure. 2. Light is one of the major environmental influences on the human physiological clock. The physiological clock is the body's internal bioregulatory system that regulates our sleep and wakefulness cycles, appetite, body temperature, and many other physiological activities. 3. The intensity and duration of light can affect the production of melatonin. Melatonin is secreted by the pineal gland and plays an important role in regulating the body's physiological rhythms and sleep cycles. When light enters the eye, these light signals are sent to the supraoptic nucleus of the brain, which in turn affects the function of the pineal gland. When dark light signals enter the eye, the pineal gland secretes melatonin, which helps to promote sleep and regulate physiological rhythms. Blue light, a type of light found in natural light and many artificial lights, is thought to have an inhibitory effect on the production of melatonin and has a negative impact on the body's physiological rhythms and sleep normalization. Here are some suggestions to help you minimize the effects of light on your sleep. 1. Use blackout curtains or drapes. Installing blackout curtains or drapes can block light from the outside from entering your bedroom, ensuring a darker environment. 2. Use an eye mask. Using a comfortable eye mask can completely shield your eyes from light entering and interrupting your sleep. 3. Avoid blue light. Avoid using electronic devices with blue light, such as smartphones, tablets, TVs, etc., before going to sleep. 4. Adjust indoor lighting. Choose warm white or yellow light bulbs. These bulbs usually emit blue light to a lesser extent. Some smart bulbs have a color and brightness adjustment function, so you can adjust the color of the light according to your needs. Choose a less blue light mode or use the sleep mode.